Manjunathaya Namaha. Dear viewers, our esteemed SDM University has welcomed the year 2020 with a big splash, especially in the area of academics. You will not believe the 4 institutions under SDM University have bagged a staggering 200 plus ranks in the recently conducted exams by the RGUHS. And to top it all, as I say, Sone Pe Suhaga, our student, Dr. Pooja Hittalmani, in her final year MBBS exams, has not only topped SDM Medical College, but she is the overall topper to RGUHS, that is Rajiv Gandhi University of Health Sciences, which has more than 40-50 colleges. So that is an extraordinary achievement, and in the very first year of the SDM University, this is an extraordinary achievement, like as if SDM University is like a child prodigy. So here I am to interview the star of the show, Dr. Pooja Hittalmani. Dr. Pooja, my heartiest congratulations. I don't have words to express the kind of excitement this campus is feeling, how we as teachers are feeling about your achievement. I don't know if it has sunk in already to you. You have achieved the first rank to Rajiv Gandhi University of Health Sciences, under which almost 50 colleges come. Now, when did you get this news of your achievement, and what were you doing that time, and how did you react?
Thank you very much, sir. It was afternoon and I was in the OT complex with my postgraduate, shifting one patient from pre-op to the OT. When we got the news that RGUHS rank list is out, because one of our surgery PGs has also got rank. And that's how we started looking for the ranks for undergraduates. And I realized that how many ranks I've got and how many ranks my friends have got. And that was a very happy moment. We were simultaneously shifting the patient from pre-op to OT, and then that excitement was there. But still, I was not completely into that feeling that I got this rank. I had to assist a OT, and by the end of the day, as the day passed, I was very, very happy because my parents felt very happy. My family was very, very happy. And more importantly, my teachers, they
Yes.
were very happy with my rank announcement.
Yes.
And that made me very, very happy. I felt contented that day.
Yeah, the news of your achievement was, it spread like wildfire in the campus. So you decided to pursue medicine. But how did you enter SDM Medical College? Because SDM is special. And usually, I'm sure you're from Dharwad, isn't it?
Yes.
Generally, people tend to look far away to very big names and all that. But you chose SDM. What was your reason to choose SDM?
Priority was to stay with the parents. That was one most important priority. And apart from that, looking at so many of my seniors who have completed their undergraduation from our college, from SDM, they kept telling that this is a very nice college.
Yes.
This was the first preference by my parents and also by me, because I have one thing, I was very particular that I had to stay with my parents, and it is hardly 6 minutes away from my home, and this also has now become my another home. That's over the past 5.5 years.
So your seniors told their
Yes.
wonderful experiences in SDM Medical College, and that made you choose, because even staying with at home you could have chosen nearby colleges, but you preferred SDM.
My parents and me, both of them thought that
They thought SDM is the one.
yes, it is the only, that was the first option,
Ah.
because we had heard that the teaching in this college
Yes.
is really excellent.
That's
And
right.
they wanted me to learn things well when I'm doing an undergraduation, rather than settle for something less.
So did SDM turn out to be what you had thought of?
Definitely much more than that.
So just take us through your journey in SDM Medical College.
Maybe if to tell 2014,
Okay.
I joined in the month of August. The day my results were announced from CET counseling in the morning at 11:30, I came and got my admission done by 2:30 in the
My
afternoon.
goodness, yeah, that is very fast, I
Yes,
believe.
because I was very happy
Yeah,
to get
that's
into this
great,
college.
that's
And I was probably one of those first people who got admission in this college.
I'm sure you must have the options to get different
Yes.
government colleges
Yes.
and all
Yes.
sort of reputed colleges.
but my first preference was this,
Absolutely.
and I
Yeah.
was
That's
very
good.
happy
That's
about
good.
it.
Yeah, that's great.
And once I got admitted, we had induction ceremony. The
Yes.
induction itself was a very beautiful experience. We got to know about the principles on which this college runs. And the day one, I realized that everybody, we had a talk by our principal, then Dr. Chowti sir. He told about how disciplined a student should be and what are the ground rules, what should not be done, what should be done. I was pretty happy that I've come to a very nice place. Day one, um, it was a very scary feeling
Oh.
of class and all of that, because I thought I'll have so many new people to talk to them, how to make friends, and more importantly, I was very scared of teachers. I thought they'd be very reserved.
Mm-hmm.
I didn't know that the teachers here are very friendly.
Very friendly, yeah.
I thought maybe PUC was a time that's when all teachers being friendly will get over. Probably a graduation course, everybody's going to be very reserved and nobody will care much, and you will have to do everything on your own.
So they made you feel very much at home,
Yes.
and all the students, I
Yes,
believe.
everybody. I can still remember those first days of all the first year teachers coming, calling all the staff members, including the attenders of that department. They
Very
came,
nice.
or they were all sitting on the chairs. They introduced themselves. Then they told us how many members are there in the department. That was actually, if they were not interested, they wouldn't have done it.
How was your interaction with your seniors? Because, generally, in the back of mind, whether we say it or not, yes, it's illegal, it's banned and all that. But generally, students, when they enter professional colleges, they have ragging in the back of their mind. Did you ever encounter anything like that?
Not at all, sir.
Absolutely.
They were more like friends, very good mentors and guides, rather
I
than.
think the culture itself is...
Yes, it is not just on paper ragging free, but it is actually in
True.
practice.
Yeah, true. That's a very nice thing you told about. And how was your journey into the academics when you entered the hospital side, the clinicals?
First years gave us very good fundamentals. Along with that, I was able to do a ICMR project in the Department of
Yes.
Physiology under guidance of Dr. Savitri. The day one in the hospital, we were very, as usual, we were very excited.
Yeah.
And then we got the stethoscope, and then we were like, we can use this now finally, not just on each other,
True.
but also on the patient. And there also we had the introduction classes, and everybody, again, the principal was very specifically highlighted. If I have to name one statement from my teacher, which which I think I'll never forget, is this place, that hospital you're stepping in today. That was from my first posting in surgery. That this hospital has to be the temple of learning for you, and your patient is your God. You treat
Fantastic.
them like your God, and then you will be able to learn.
I've heard about this word, SDM culture. It's about how this whole university, the campus, it has a vibe. People, all of them are somewhat, whether they consciously or unconsciously, they seem to be like-minded and think in the same direction. Whether it's a student or a staff. I have seen, academics or even extracurricular. There's so much encouragement. What kind of atmosphere do you come across usually during college fest or even otherwise? How this whole culture, can you just tell us about it?
STM culture, yes, it has to be spoken about. As a student, as you said, as any student, any medical student would be like, it's a lot of pressure, only reading, and clinically being very much better. But here in this college, we have a different protocol, a different kind of atmosphere, where you see students not only doing well in academics, or not only being stressed and spoken about academics, but also about extracurriculars.
True.
Because our teachers themselves are, again, multifaceted people.
Yes.
They are not only who are going to come teach and go back home
Yes.
at 5 o'clock. They are someone who are interested in music, dance,
Yes.
maybe photography, everything.
There are so many clubs.
So many
culture
clubs.
Yes.
Yes. And every year we have Deja Vu, which is our college fest. And each one of us have participated in all those fests. And that is a kind of a relaxation for us.
True.
And though the fest is only for 3-4 days, we have a preparation and planning for as long as 2-3-4 months.
True.
And sometimes other activities like still waters, that takes around 6-7 months.
Yeah, it's a college magazine.
It's a college magazine, which I've been a part of, and I'm very
Excellent.
happy that I've been a co-editor for that magazine.
So all students get to explore their other
Yes.
talents and
Yes.
enjoy that part of their personality also.
Yes.
That's because otherwise people think students who are doing medicine, they are always dull and boring. I think that is
Definitely
far
not.
from truth. And also I have seen this excitement among students during this charity walk. You get to participate in an event which means so much to you to raise charity.
Yes, definitely. Because first year it was a new thing for us. Yeah, we were so excited. Then we realized that whatever donations we get, it is going to go to Poor Patients Fund. It was a very good experience. This college not only teaches us how to treat a patient, but also to get accustomed to what is the social status of the patient, which person might need help. One of the staff also keeps telling that one day when a patient walks into your hospital, treating them should be the priority. Whether they are able to pay, not pay, should not be a matter of concern. That is the kind of doctors they're making from this college.
I remember you telling once, as soon as you people enter, once you are taken to Dharmasthala. Yeah. I mean, I think that is a very interesting thing. How was your experience visiting Dharmasthala? How do you look at, being part of an institution which is run by Pooja Shri Virendra Hegdeji and his aura, the kind of presence he has?
The concept of having a trip in the first month of college itself was very exciting. And Dharmasthala, I visited Dharmasthala before as well, but not as a student of SDM Medical College. It was entirely different.
Okay, yeah.
It was more, we were privileged. We were taken so much of special care, and then they took us to the temple. Then very special event was when we were able to meet Pooja Shri Dr. Virendra Hegdeji. He spared around 1 hour with all of us, spoke to us, and he answered our questions also. There he mentioned about one very beautiful analogy that I would like to tell. That they told, someone asked him as to what would you do if you are not what you are today.
Okay.
If you're someone else. He told, this watch or a clock, every piece and bit of it is got different rules. Even if one stops functioning, the watch or the clock will stop functioning. That is when we realize that wherever we are, whatever we are, we should continue doing our best.
True.
Definitely, it will be a part of the society, and we will be able to do something better. Maybe we will not be able to see it now. Due course of time, we'll be able to.
Very nice. And throughout your journey, I'm sure you were influenced by just some people like our vice chancellor. Just looking at him, just interacting with him, you get so inspired. What was your experience throughout your journey through SDM? Whenever you met him or whenever you heard him talk, giving speeches?
It was a really very good feeling. We used to listen to his speeches in the few events. Sir would always inspire us whenever he talks. And I also had a privilege to work under plastic surgery during my internship. There, I realized that whatever they preach is what they practice, and whatever they practice is what they preach, rather than keeping it apart. And one thing is that the very fundamentals, maybe like punctuality and discipline, everything, not just in the SDM campus, but also each and every person associated. You can see that, you can feel that.
The respect for the human being ahead of him, that the kind of gentlemanly behavior.
And he treats everybody so equally.
Yes. These are all the things I get you learned and ingrained subconsciously.
Yes, I would like to tell it as a transformation from maybe we came in as caterpillars.
Yes.
Caterpillars into this, that analogy I would really like to quote. We came in as caterpillars, and gradually they turned us into butterflies.
You are the torch bearer of SDM University. Whether you like it or not, you have it in your hand. How would you like to take it further?
This thing has to actually sink in. It's going to take some time. But I'm really happy that any student who comes into the college has got so much to do for the student.
True.
They have given their time, efforts, just because each and every one of them are equally interested in teaching. They all strive for the betterment of students. Every single teacher from day one till this day, whoever is teaching, not just the teaching staff, but also the non-teaching staff of this institution. Right from the minute I enter the gate, or from security office, to the time I come to the class, or maybe go to the OT, anywhere you go, that principled approach, that attitude in everybody is the same. They want the betterment of the patient, of the student, and that feeling actually inspires me. This organized setup actually helped me try to be more organized.
Very nice.
And it's like a reciprocative thing. If they are doing so much to us, and we should be giving back something to the institution.
Absolutely.
And that makes me feel very happy that I'm able to make this college happy and proud about whatever we all have done.
Fine. Fantastic. So what's your future plans? Which specialty are you interested? What would you like to pursue? Where do you see yourself 5 years from now?
5 years from now, I would like to see myself as a clinician.
Okay.
Probably a physician or a pediatrician.
Yes.
Or an obstetrician.
Yes.
I haven't decided the branch yet.
It doesn't matter, yeah.
But I'm also interested in administrative services.
Oh, that's good. That's interesting. Yeah.
And also an international organization. I would like to be a part of it. If not administrator, at least this part. So I would like to try and club my things of interest into something that will be a very good job in it.
Okay. All the very best for you. In whatever dreams that you have, I hope you achieve all of them. May all your dreams come true. And you keep making SDM University proud for the contribution SDM University has done, each and every staff and teachers, as you said. I hope you make the best out of it. Congratulations once again.
Thank you, sir. Thank you very much.